Welcome to Season 2 of Keeping It 100 Real Conversations with Jacqui, where each week we will discuss life experiences with subject matter experts. Stay tuned for this next episode. Hello and welcome to Keeping It 100 Real Conversations with Jacqui, where we discuss real life situations. And today I have my very dear friend, Dr. Lynda Chen, who is the owner of Advanced Health Group. And we're going to be talking about soft tissue therapy. And I'm going to give her a chance to introduce herself, tell us a little bit about herself. Hi, Lynda. How are you today, my dear?
Hello, Jacqui. Thank you for having me here today.
You're very welcome. You're very welcome. Thank you so much for taking the time to come in and join our show today. And I'm really excited about the topic that we're about to discuss. And I think people out there are probably excited to hear all about it too.
That's great.
Yeah. So let's talk a little bit more about yourself. Tell everyone who you are, what you do, what you're about, and we'll dive right into the heat of things.
Okay, that sounds great.
Awesome.
I'm a chiropractor and I practice in Calgary, Alberta here, and I have my own practice called Advanced Health Group. And my training started almost 14 years ago, where I went to the Canadian Memorial Chiropractic College in Toronto and graduated in 2011. And moved straight out to Alberta here and started practicing. So since then, it's been a slice.
Awesome. That's great. So speaking of which, so you're a chiropractor, and when people think chiropractors, they think chiropractic adjustments. So let's dive a little bit more on what you actually specialize in, and then that will lead us into that soft tissue therapy that we want to discuss a little bit more about it.
Fair enough. So when the public thinks of a chiropractor, they often think of the crunching, the cracking of bones, spinal manipulation to the spine, in the neck, mid back, or lower back, and that is one style of practice. And the beauty of our profession is that there's different techniques, different styles of chiropractic, and the type of chiropractic that I've chosen to dedicate my work to is towards more of the soft tissue style. So what that means is my focus is on top of musculoskeletal. It's not just to the spine, but I like to work on the extremities like shoulders, knees, hips, ankles, fingers. And the area that I like to treat would be more of the muscular layer, muscular fascial layer. That's why we call it soft tissues, because there's anything but bone.
Mm-hmm. Yeah, and I mean anything like but bone, meaning muscles and ligaments and all that stuff that you discuss.
Yeah. Right. So
awesome.
On top of working on the soft tissue layer, I also address joint pathology as well. Mm-hmm. But we usually term ourselves soft tissue practitioners, just to give the public some idea of the different types of techniques that we do.
Mm-hmm. That's awesome. That's great. So, okay. So when someone is kind of curious to know, okay, I need to see a chiropractor for a specific issue. What are some of the things when a client comes and sees you for the first time? How do you kind of distinguish whether they need soft tissue manipulation or they need maybe adjustments? How do you usually go about it?
Well, usually with a pathology, like any sort of injury, you'll need a combination of both. And so it depends on the patient and what their comfort levels are. So I have some patients that have been exposed to the spinal adjustments and they do quite well with it. And they see a chiropractor periodically to help put their spines in alignments, and it works for them. And I encourage them to continue seeing their practitioner because that's what their body has been accustomed to and is doing well with it. So when they come see me and they have a joint injury or soft tissue injury, I like this personally, just what I like to focus on. I like to look at the muscular layer and then from there dive into the joint layer. Like you can't have one without the other. And so I guess that's a big misconception when people think of chiropractors, that we are only specialized in joints and bones, but we also have the knowledge and skill set to address muscular fascial adhesions as well.
Okay, perfect, awesome. And speaking of the soft tissue portion of it, as a personal trainer, I mean, we obviously we know a little bit enough to work with a client to be able to work with what they need, and we typically would use foam rollers, what you call it, lacrosse balls, or anything that has anything to do with like just that fascia breakdown, like manipulation with those tools. So what makes you guys different from what we would do as personal trainers? Because you guys are more hands-on, you're obviously more clinical as well. So what makes you stand out, and what makes you more, you know what I mean? What makes your part really, really important? Because that's what usually that's what I will do, is like, if I can't deal with the problem, I usually will refer some of my clients to you, right? So, yeah.
Yeah, well, we've worked really well together.
Mm-hmm.
And so I can describe our dynamic a little bit more specifically. I think not one is more important than the other. I think collaboratively, we all work together to help that patient
Mm-hmm.
get the goals that they want. So how my role would differ from, say, a personal trainer is when a patient sees me, whether they're referred from another practitioner or a family friend, is to assess them to see the injury in a 360-degree aspect. So I'll give you an example. So say a patient had elbow pain,
Mm-hmm.
and so it would be my job to identify, is it truly an elbow pain, or is it pain coming from the shoulder shooting down to the elbow and there's really nothing wrong with the elbow, or worse, coming from the neck and then going all the way down to the elbow. So with
Mm-hmm.
my skill set, I'm able to identify the pathology, but not just pathology, but like where it came from, the etiology of it, and then from there create a treatment plan involving hands-on. So when I say hands-on, this is where the therapy comes in, where we're doing the soft tissue release to fix the tissue injuries that
Mm-hmm.
come with it. And then how we would work with personal trainers is, like, for instance, with you, saying, this patient X has lower back problems and they
Mm-hmm.
need to strengthen, because your expertise lies in how to strengthen the body. So after repairing it, they need to build up their foundation again. And that's why they would see a personal trainer, to have
Mm-hmm.
that guidance of how to retrain their body in a very safe manner. And then, of
Mm.
course, with your extra knowledge and skill set of knowing how to like foam roll and doing ball release, that just reinforces everything that the patient's supposed to do on their own, because patients are
Mm-hmm.
supposed to take their health into their own hands.
That's true, exactly. Eventually, I mean, we create those tools for them to be able to go out into the world and be able to live their best lives
Exactly.
with limited pain, right? And
Exactly.
be able to function.
Exactly. So what's important is we have to fix the injury. So when when an area gets injured, there's scar tissue that forms, and we can't rehabilitate on scar tissue, because
Mm-hmm.
that's a poor foundation.
Mm-hmm.
So my job would be to repair it as much as the body will allow me, and to encourage that body to heal properly. Mhm.
Okay, so in terms of demographics now, like would you say that soft tissue therapy is beneficial for a certain age group, or is it beneficial for all sorts of age group? Like how would you say that would be?
I think it benefits all age groups,
Hmm.
and all sorts of injuries. Like I said earlier, just because I'm a chiropractor, I don't just see conditions related to the spine. Like we
Hmm.
treat extremity problems as well, like shoulders and knees, for instance. So I think soft tissue therapy is it's very versatile. It can help any age group, any injuries. You don't have to be an elite athlete to seek out soft tissue therapy. You could be um, a mom that just gave birth and is suffering from upper back pain from breastfeeding. It could be
Hmm.
any sort of injuries that bring you to see a therapist that can do soft tissue release, and not just soft tissue release, but like joint assessment as well too, because that's
Right.
just as important.
Mm-hmm. And okay, so let's talk a little bit more about the actual benefits of just everyday therapy, right? I mean, regarding soft tissue, a lot of the times, people think that, okay, I'm just gonna see someone just one time and the pain will go away. But I mean, let's dive a little bit more on like the benefits on ongoing benefits of just soft tissue therapy, just even in general. I mean, even if you don't have specific pain, or maybe you just want to go and just get your whole entire body
Mhm.
I don't know, feeling good. Yeah.
Yeah, well, I usually like to describe injuries to patients in three stages. So the first stage, most often when I see a patient, they're in pain, there's something not working properly, they're not moving properly. And then I assess them like, okay, you're right, there's something wrong with this joint or there's something wrong with this muscle. So that's the first
Mm-hmm.
stage. And then as we treat them, their pain levels will drop down with time and with care. And then what most people do is when their pain drops down, they forget, oh, I have no more injuries to report. But the
Yeah.
problem is, pain is typically the last thing that shows up, but the first thing that goes away. But the pathology is still festering there. So the second
Mm-hmm.
stage of care is when they come to see me. They're like, I'm no longer pain, and I think that's great. Um, and I encourage them to continue with the rehab because most often when I check them, reassess them,
Mm-hmm.
either the muscle is still not strong but they're not in pain, or they're not in pain but they're not moving as flexible as they should be. So that's the
Mm-hmm.
second stage, and then the third stage is the golden point where they don't have any issues, and when I check them out they feel pretty good.
Yeah.
And so, that's the thing I like to describe to people, that pain is not the only measure that something has gone wrong on your body. It can
Mm.
be anything from stiffness to pain to like clicking or pinching. So
Mm.
pain is not the only measure.
Okay, that's good to know. So, like when we are discussing soft tissue therapy, I feel like sometimes there's also like that fine line with soft tissue therapy and mobility or flexibility, right? What would be your take or important information to kind of like put out there in terms of those two relations?
Sure. What I always like to tell patients, especially patients who like to do, like, for instance, weight training, they're very focused on strength. But as equal as important as strength is that you need to be flexible too. You need to have proper joint mobility and tissue
Mm.
extensibility, because
Mm.
if you have any impairments in those systems and you're trying to build strength, that's a recipe for disaster.
Yeah.
So that's what I like to emphasize to patients, that strength is important, absolutely important, but just as equally important is flexibility.
Yeah. It's like putting a foundation on an unstable piece of land. Eventually, it's going to fall off,
That's right. You can be the
kind of thing.
strongest person. Exactly.
Yeah.
So I see a lot of people who, for instance, they do a lot of bicep curls, and
Hmm.
their biceps are very powerful, but at the expense of the tendon anchoring the bicep muscle belly. And
Hmm.
so their shoulders are quite tight, their neck is quite tight. So
Hmm.
functionally, they're not moving as well as they think they are, just because their biceps are quite powerful.
Right. Yeah. Like, I mean, that would even dive into like more like posture deviations, right? Like poor posture. I mean, you could be doing bicep curls like literally hunched over, and you would think that, oh my gosh, I got this, but in fact, there's something else going on behind, or yeah.
Exactly, exactly. And that's
Hmm.
when I would refer to a personal trainer, because it's a personal trainer that will go through with them in detail how their posture is, because that's
Right.
the expertise of personal trainers,
Hmm.
to take it slowly and take it step by step with them, um, as you probably know.
Yeah, absolutely. I mean, okay, so like just a little bit of a background just to kind of let everyone know how we even met. So I remember, I think we met in 2013, correct? At a show, at a women's
Yeah,
health show.
it was at the BMO Women's Health Show. Yeah.
Yeah, health show. I think it was 2013, and I remember going to the show just randomly because I just wanted to check out what was going on there, and I just a little bit of a background, which I've probably mentioned in the previous episodes, maybe discussing something else, was that I do have scoliosis, and you literally taught me a thing or two about soft tissue therapy, and I am a huge, huge, huge believer of it because you're like my saving grace. You fix me every time. So right. So yeah. So if you're listening to this and you feel like there's just an ongoing discomfort that's going on with you, I really encourage you to reach out to Dr. Lynda Chen, and she would be happy to have a chat with you. And you're located. Where are you located, Linda?
So we are located just off Deerfoot Trail on 32nd Avenue on the
Yeah.
east side. And so
Awesome.
we're in the professional building right at that corner.
Right. And
Mhm.
you guys also have acupuncture and massage therapy as well there, right?
That's right. So
Yeah.
my goal when I opened up the practice was to
Hmm.
have various different practitioners so that we can always collaborate, because there's never just one person that can help the patient. It's usually a
Hmm.
team of different practitioners. So at our clinic, we
Absolutely.
have a traditional Chinese medicine doctor, an acupuncturist.
Hmm.
So she does both. And we have a physiotherapist and a massage therapist and myself.
That's awesome. That's
Hmm.
perfect. That's
Yeah.
awesome. So it's all in one kind of clinic, which I love. Which I love. Okay, well, okay, so like, okay, just to kind of didn't mean to veer off the topic of soft tissue therapy. So when we are now talking towards people who are new to fitness and they still feel like okay, they have the lower back issue that's ongoing, but every time they exercise, they literally don't know what to do because they feel like exercise is the one that's causing the lower back um, um, tendencies. What would be your advice to someone out there that's literally listening to this show and they're like, I have this ongoing either lower back pain or knee pain? What would be your advice to them at this moment in time? What can they go? Can they go about it without giving up on moving our body? Because we know our bodies are meant to move, right? Like the
Mhm.
mechanical movements of our body, right?
Well,
Mm-hmm.
I think it's great that everyone's trying to get a little bit more active after the 2 years of sedentary lifestyle that we've had, and
Yeah.
so I applaud them first and foremost because the last thing you want to do is discourage them. But if you're feeling, you know, any sort of discomfort and you
Mm-hmm.
know that exercise seems to aggravate it, I highly encourage that you get it assessed by somebody that's trained to assess you, whether it's a chiropractor or a physiotherapist.
Mm-hmm.
And there's so many of us in the city that you can find a
Yeah.
decent one. But basically, I would encourage you to get it assessed because you never want to push through pain. And if you push through pain, you might cause further injury. So, like, there's something
Mm-hmm.
obviously telling you that 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 something's wrong. So, pain is never a bad thing per se. It's an indicator that something is not working well in our body. So, I encourage you not
Mm-hmm.
to push through that pain, but to investigate what is
Yeah.
causing that pain.
Mm-hmm.
Because oftentimes whether it's a joint problem or soft tissue injury, such as like stickiness within the layers. So we call that adhesion, soft tissue adhesions, or some people will know it as muscle knots. Um, all those things can affect how you move. And if you push through it and you ignore the signs and symptoms, you're going to sustain a much further serious injury. So get it assessed. And then,
Mm-hmm.
that's part of your recovery. It's not just to do exercise, but to, take care of your body as well.
Yeah, yeah.
Mhm.
Pushing through the pain is never. I'm like a huge believer of like listen to your body. So if you're feeling pain, it's not necessarily a good thing, or never. It's never really a good thing actually if you're feeling any sort of pain while
Mhm.
you're doing any form of exercise.
Right. It's a good
Awesome.
indicator. Mhm.
Yeah. All right. And okay, so like okay, do you have any question? I mean, do you have anything else to basically, let people know about in terms of what you do and just before we close off the show cuz it
For
yeah.
sure. Well, I just
Mhm.
want to emphasize that, in the profession of chiropractic, again, a lot of people think chiropractors are, you know, bone crackers, or if you want to call it that, or all they do is adjust or crack bones.
Yeah.
That's a very um, common assumption. And
Yeah.
that's a fair assumption because traditionally that is the focus is spinal manipulation along the spine. And it has its place and it has its importance and effectiveness as well. Um,
Mhm.
but nowadays, with where chiropractic is going, it's a spectrum of various different practitioners, and
Right.
not one is better than the other. We're all just a
Mhm.
little bit different, and it just depends on what your body needs.
That's
So,
right.
talk to your friends, ask them what has worked for them,
Mhm.
do your research, and yeah, always talk to your practitioner if there's something that they do that doesn't sit well with you or you're uncomfortable about it, because you
Mhm.
do have that voice when you're in the room with the practitioner.
That's true. Never be shy. Like be your own advocate, basically your own health advocate if you can
That's
help it.
right.
If something doesn't sit right,
Hmm.
ask the questions. Don't
Exactly,
feel like you're
exactly.
second guessing someone else,
Right.
right?
And I have a lot of patients that see me and see their other chiropractor as well,
Mm-hmm.
because they know what I focus on, which is their soft tissue injuries.
Yep.
And they come to me, if, they've sprained an ankle or hurt their shoulder. And then they see their other chiropractor that they've seen for a big portion of their adult life,
Yep.
for the spinal adjustments that have
Mm-hmm.
made them feel so good. So, you don't have to be exclusive to one. You just have to find what works for your body. And so I
It's
have
true.
lots of patients that see both, and that's how we
Yep.
work as a team.
And then they just maneuver. Yeah, exactly. Actually, speaking of spinal maneuvering, so what would you say would be, I mean, in your professional opinion, if if someone is like, okay, I want to go see a chiropractor, there's something wrong with my back. They have no idea what it is, but they're like, there's something wrong with my back. I feel pain all the time, and then they just go to a chiropractor, just random, and they decide to just do an assessment. In your opinion, do you think that everyone needs a spinal adjustment when they have back pain, or there's something more that we could probably ask certain questions about?
That's a tricky question.
I don't know if that makes sense.
No,
Without putting you on the spot, which you are, by the way. We're keeping it 100, right?
yeah, that's right.
Yeah.
That's a tricky question. Can everyone benefit from a spinal adjustment? I believe so. It depends. Like, there's always a right time and right place to do the spinal adjustment.
Yeah.
Spinal adjustments in the research have been shown time after time to be a very good alternative form of treatment versus, like the study shows, other sorts of like pain medications, for instance. Not saying pain medication is a bad thing. I'm just saying that that's what the study shows.
Right.
And it's been proven to be an effective way to help with like neck pain or back pain, even with children with colic. And so, can everyone benefit from spinal adjustment? I believe so. Like, even posturally, like, we're always hunched forward, and it does help relax the overlying musculature when a patient gets an adjustment. But like what I said, there's always the right time and place. And before an adjustment can be delivered, and all chiropractors do this, is that it has to be assessed properly. It can't be automatically done. Like, you know that joint is fixated, or that joint isn't moving as well as it could. And so that's what the adjustment is. The adjustment essentially is to restore proper motion of
the actual joints.
That's right.
Okay.
So can everyone? Yes, because we all have postural faults.
Right.
In that sense. That was a tricky question, though, Jacqui.
Well, I mean, sometimes I just need we need clarification. I'm pretty sure I asked the questions that I know some people kind of have at the back of their minds, and they're like, was this really right for me? And I'm pretty sure I've asked you that question, so I wanted to ask you again so that everybody can hear it, right?
I think deep down we all know when we get treated, if something felt right or not, whether it's an adjustment or whether it's a soft tissue release maneuver. We all kind of know, like, oh, that doesn't really jive with my body. So my best advice to patients is, ask the questions, ask the hard questions to your practitioners. We should be able to answer those questions and reassure you. That is part of our job, is to reassure you that, what we're suggesting has more benefits than risk, right?
Yeah.
And do your research and ask your friends, and always listen to your body. If something doesn't feel quite right, talk to your practitioner about it. We're here to have that dialogue.
Absolutely. What works for me won't necessarily work for you, won't necessarily work for the next person, right?
Exactly.
So absolutely. That makes sense. Well, thank you so much for joining us on the show today, Lynda. And so a little takeaway I would say is listen to our bodies, be your own advocate for your own health, right? How you feel, how things feel, or if things don't feel right, say something, right? And ask questions, ask, right? All right. Yeah, exactly. Okay.
Thank you.
Perfect. You're very welcome. So I will leave all your information in the show notes. If you guys want to ever reach out to Dr. Lynda Chen, please do so. She's amazing. I'm her huge fan. So, and I believe in what she does. So anyway, I'll leave all her information in the show notes. If you guys need to reach out to her, please don't hesitate. I'll leave her email and website and all that good stuff, whatever social media that she wants me to put on the show notes. Thank you so much for listening to our show today, you guys. If you guys have any questions, comments, please don't hesitate to also email me at Jacqui@rhythmfitness.ca. And thank you so much for tuning in, and we'll catch you guys on that next episode. Thank you so much for tuning in to this episode. Please do not forget to leave us an awesome review, and don't forget to subscribe to our podcast and keep your notifications on for the next episodes ahead. If you'd like to be a guest on our show, please do not hesitate to contact us at Jacqui@rhythmfitness.ca.